Good afternoon. I will demonstrate the emergency management for uterine atony, a funda massage, and uterine balloon tamponade. So let's start with a funda massage.
Assessment. First, assess the woman with factors that predispose to poor uterine tone or inability of her uterus to maintain a contracted state, such as conditions that increase for postpartum hemorrhages. Second, obtain the mother's blood pressure and heart rate, because blood pressure drops abruptly due to vaginal bleeding. Third, check for loss of blood that leads to hypovolemic shock, such as falling blood pressure, a rapid, weak, or tardy pulse, increase in shallow respirations, pale, clammy skin, and increasing anxiety. Fourth, estimate the amount of blood by counting number of perineal pads saturated in given lengths of time, such as half-hour intervals. A rough estimate of the amount of blood loss can be formed. Next is planning. First, explain the necessity for the procedure and provides privacy. Second, position the woman on her side when expecting for blood loss to be certain a large amount of blood is not pooling undetected beneath her. And lastly, palpate woman's fundus at frequent intervals to be assured her uterus is remaining contracted.
Good afternoon, ma'am. I am Marina Padilla, and I will be your nurse for today. Ma'am, may I know your name? Okay, ma'am, Mary. Ma'am, I will render a funda massage to control vaginal bleeding and encourage uterine contraction. Is it okay for you, ma'am? Okay. So I'm gonna close the curtain. So rational, explaining the procedure to the client helps to decrease anxiety, and providing patient privacy enhances self-esteem. So ma'am, before we begin to the procedure, I will assist you to void or urinate to lessen the pressure and avoid discomfort. Is it okay, ma'am? Okay. So this part is optional unless the bleeding is extensive. Rational, an empty bladder prevents displacement of the uterus and ensures accurate assessment for uterine tone. So ma'am, may I assist you to lie on your bed with your knees flexed? Is it okay, ma'am? Okay. Rational proper positioning enhances visualization and effectiveness of the procedure. So before we begin to the procedure, I will wash my hands first and I will put a clean gloves. So okay, ma'am. So ma'am, I'm going to start to massage your fundus by placing my one hand on your abdomen just above your symphysis pubis, here ma'am, while my other hand is around the top of your fundus, here. So rational, this anchors the lower uterine segment and allows to locate and to assess the fundus. So ma'am, I am now rotating my upper hand to carefully massage your uterus to encourage uterine contraction. So, massage the uterus until it is firm, being careful not to over-massage. So, okay. So, rational, massage should be done when the uterus is not firm, and aggressive massage may lead to partial or complete uterine prolapse. So, okay, ma'am. I can now feel that the uterus is firm. So, ma'am, I will now press your fundus between my hand with slight downward pressure against my lower hand. So, stay relaxed, ma'am. Okay. So, rational, gentle squeezing with downward pressure helps to expel blood or clots collected in the uterine cavity. So, okay, ma'am. Ma'am, please allow me to check your perineum in order to remove the passage of clots and estimate the amount of your vaginal bleeding. Is it okay, ma'am? Okay, ma'am, thank you. Okay, ma'am. Okay, so rational, this helps to assess the degree of bleeding. So, ma'am, we are almost done. So, I will do a funda massage one more time just to make sure that your uterus is firm. So, is it okay, ma'am? Okay.
Okay, ma'am, again. Okay. Okay, ma'am.
So ma'am, I'm done with the procedure. I am now cleaning your perineum, and afterwards, I will apply a clean perineal pads. Is it okay for you, ma'am? Okay, ma'am. So, I am now cleaning your perineum. Stay relaxed, ma'am. After the procedure, I will remove my gloves and wash my hands for infection control. And lastly, I will document the result of the procedure and I will assess the fundus and leukemia. And also, I will notify the primary care provider if the fundus does not remain firm and if the bleeding is continuous. So rational documentation provides a means of evaluation and continued assessment, allows early identification and prompt evaluation with additional measures such as oxytocin to prevent hemorrhage. So next procedure for the management of uterine atony, I will demonstrate uterine balloon tamponade. So first is assessment. Assess the woman's status and assess the client's capability to follow instruction. Next is planning. I will gather all items that I will need for the procedure. By making a uterine balloon tamponade, following institutional protocols, we have 2 sterile gloves. Next is povidone iodine, intrafolic catheter, saline solution for irrigation, and 50 cc syringe, but I have only 10 cc syringe. So rationale for easy accessibility. Good afternoon, ma'am. I am Narina Padilla and I will be your nurse for today. Ma'am, may I know your name? Okay, Ma'am Mary. Ma'am, we will be doing emergency management for your postpartum hemorrhage by making a uterine balloon tamponade to stop the bleeding. I will make a balloon and inflated it inside your uterus to stop the bleeding. And I want you to take a slow, deep breath and stay still. Is it okay, ma'am? Okay. Rationale to relieve anxiety and apprehension. So, ma'am, if you can stand up to urinate in the bathroom, I can assist you. But if you feel dizzy, I can offer you a bedpan or I can insert catheter that will help you to urinate. Is it okay, ma'am? Okay, ma'am. So rationale, a full bladder can weaken contraction and delay separation of the placenta. So, ma'am, I will assist you to lie on your bed with your legs apart. Is it okay, ma'am? Okay, ma'am. So, legs apart, ma'am. And I will drape on what is not needed to be exposed. So, like this, ma'am. So, rationale, for easy visualization and provides privacy. So, ma'am, I will start an intravenous infusion to restore the blood loss and I will mix a medication to your intravenous fluid that will help your uterus to contract. Is it okay, ma'am? Okay, ma'am. Rationale, this restores blood loss and treat shock and also to keep the uterus well contracted and prevents bleeding. So before we start the procedure, I will wash my hands first and I will put an antiseptic solution over the thigh. So ma'am, I will put an antiseptic solution on your thigh. And next is I will put on sterile gloves. So rationale, this protects you by preventing any accidental contact of a substance that could carry a microorganism through breaking your skin. So now I will put on sterile gloves. And I will start making an uterine balloon tamponade by inflating intrafolic catheter balloon. So by making a uterine balloon tamponade, I will inflate the intrafolic catheter balloon or the catheter balloon to check if there's a leakage on the inflated balloon. So here our Foley catheter. Then this will be serve as our intrauterine balloon, a glove, a clean glove. So we will put here this. Like that. Then we will secure it so that the fluid will not leak. So this part should not be too tight. Like that. So next is I will inflate the catheter balloon to ensure there's no leakage. by 3 ml normal saline. So here is the catheter balloon, as you can see. So I will deflate it. So let's start to insert the deflated balloon. So I will insert the deflated balloon and like that until it reaches the uterine cavity. Then I will inflate the catheter balloon first so that it will remain to the uterus. Okay. Next is I will inflate the balloon by sterile saline solution up to 500 ml until it can be seen in the cervix. That. So we are almost done. So this is the uterine balloon tamponade. So I will clamp the catheter here. And next is I will tape the catheter to the patient's thigh for gentle traction. Here part. Next is I will connect the drainage port to the catheter to the fluid bag to monitor the amount of blood loss. So here's our drainage bag. So we will connect it here. And I will put this drainage bag below the patient's thigh. So rationale to monitor the amount of blood loss. So but first is I will unclamp the catheter to allow the flow. After the procedure, I will remove my gloves and wash my hands, rationale for infection control. And next is I will continue to monitor the client's vital signs, urine output, fundal height, vaginal bleeding, and the amount of blood loss. Rationale is to monitor if the client is experiencing a hypovolemic shock. Next is I will document the procedure on the nurse's notes, and if the bleeding did not subside, I will refer the client to a CMOC facility. So rationale is to provide accurate data in the care of the client. Thank you for watching.